To this now, NGOs are taking their grievances to the health department in Pretoria this morning. Well, they say there's uncertainty about their contracts with government. This means they may not be able to provide services. We're about to discuss that with Oupa Dlamini from the NGOs Forum of South Africa. Mr. Dlamini, thank you for your time. Good morning to you.
Thank you, ma'am. Thanks for having us. Thank you.
Now, where did your problems actually begin with the health department regarding these contracts?
Well, what we have is that in October 2020, these contracts were extended for 30 months. So generally, as a norm, we would have expected the department in August last year to communicate to us to say, look, we are changing priorities. So this is where we want interventions. As you would know, the position now is we need to address young people, the key populations, your men who have sex with men, transgender, young girls and boys. So that has not been communicated. So when the contract ends next month, our staff, our field workers need certainty. At this point, like in my office, I have to give a notice to terminate the contract by end of March. You're talking people who are married, people who have children, go to school, got houses, cars. So the services will gradually stop because we have partnerships with your clinics, your hospitals, where we get commodities like HTS, testing kits, your condoms, so that we are able to provide these services. Because there's been no communication, and our biggest challenge is this. If they have not issued a call for funding by now, when they issue it, let's say they issued next week, you still have to have a briefing session. That's time. We have a closing date. That's time. They must organize a committee to adjudicate on proposal. That's time. There must be a submission. That's time. The signatures to the DG, to the finance, it can take a month or two. So you're looking at a situation where NGOs in the country may get funding around August, September. By that time, you're already, your overheads, you are in debt with your landlords, your services has cut, you have lost your staff, you have lost... So it's a crisis, but I hope it's something that we could easily manage, because what we are demanding is, because we are late with this RFP, extend contracts for 9 months so that by that period you are able to issue this call, you prioritize your areas for intervention, you receive application, you adjudicate, you contract those we have deemed to be successful that you think are relevant to this provision that you want, so that then we continue from January next year.
Yeah, I'm assuming that before you got to this decision to actually march to the offices of the health department, there were efforts that you had made to trying to get their attention, getting their response, and you mentioned that they hadn't communicated. Yes. What was the journey like for you as NGOs leading up to today, where you said we will march to your offices and hand over this memorandum?
Generally, what you have, every 3 months, department will send what they call performance monitoring officers. Those who come and check us every quarter. How have you been implementing your program? Have you accounted financially? What is the impact? So they take that back to their management to say, in these NGOs we've funded in these provinces, this is the impact. This is how they've use the money. These are their reports. These are their auditor statements. So they know. So those serve as a link between us and the department, because we engage to say, where is the trend? What is going on? Sometimes we send letters to the office of the Director General. There's just no response.
So no communication whatsoever from them?
We are forced. I can tell you for a fact, we were supposed to meet the minister last year, August, but, they kept changing posts. So because people want certainty, and we don't have to stop program services in the community, because we are saving young people. Like in my office, people come for PrEP, people come for testing, people come for condoms. So all these will have to cease. And we are forced, unfortunately, to take the steps we have.
So maybe perhaps share with us what exactly is in the memorandum that you'll be handing over.
In memorandum is exactly what I've just said. We are demanding that the department extend the current contracts from April to December, so that in between that period, then they can organize themselves in terms of which areas they want intervention. And we know for sure it's going to be key population, which are young boys and girls, men who have sex with men, transgender, so, the migrant workers, so that they have ample time. and give us space while we implement it, then we can apply it to education so that there's continuum of services. We can't break. So that from January next year, the services do continue while they go in all these processes.
And I suppose my last question to you, if your memorandum is not well received because you are dealing with a department that does have a reputation of not communicating in time, not meeting deadlines in this instance, if again they don't meet your set targets within the memorandum, what are your next steps?
Well, we have to put pressure. For instance, we've engaged the Health Portfolio Committee on Health. We've written to the President, we've written to the Minister's Office. We got permission from Metro last week to march. And if they don't listen, we gave them 7 days to respond. If they don't, we have to march again. We must use a lot of pressures, unfortunately.
And this all in assisting, of course, those youth within your communities.
Yes.
Well, I appreciate you coming on to the show, Oupa Dlamini, and talking to us. The National Chairperson of NGOs Forum of South Africa, thank you so much for your time. We'll leave it there for now.